One of the things that we want to do is we want to start with the basic understanding of what motion is and why we talk about motion. We're going to be bringing some good clients and actually a lot of talent to discuss exactly what we do and how we do it at our particular office. Now, I've been practicing now for 30 years now. We've been able to assess the types of practices and gone through these protocols over the years and established kind of a working order of the type of things we do. Now, many times that people don't understand what a physical medicine doctor does, but we're here to explain exactly what we do and why we do what we do. Today, what we're going to do is we're going to begin exactly with the science of motion. In terms of understanding motion, we can link motion to the healing processes that are wide and vast. And what we do is we tie in what we do and how we do it with different types of practices and protocols. So in our practice and understanding of what physical medicine is and what motion sciences are, we have to first understand that everything is related. Everything is connected in terms of motion, in terms of the human state. From the moment we're born, from the moment we actually experience life, we have to assess that we came to motion from life, from inanimate structures to actually organic material such as a baby, and eventually we ultimately spend our entire life moving. My premise is that motion is life. The lowest extent of what we do is to the extent at which we can move is to the extent at which we can live many ways. So in our process, we cross and crisscross different dynamics, and we talk about disorders that are far from understanding, that are simple to understand, such as spasms, to far-reaching issues like autoimmunity, functional medicine, wellness sciences, and we try to bring it in with the motion sciences and seeing how the correlation is. So what we do today is what we're going to do today is begin the process of understanding why we focus on different parameters and different protocols to treat people. My name is Dr. Alex Jimenez, and I'm here with an amazing group of people. I've been practicing here for the last 30 years. That's 3 decades, or 1.5 clicks, according to Lincoln. We have to determine what is in the best benefit of our population. And what we've learned is that we, as doctors, we can come together to treat our patients, and we have to correlate what we do together. I work with diabetic specialists, I work with endocrinologists, I work with rheumatologists, I work with orthopedists. I work with any doctor that understands that the physiology of whatever the disorder may be is motion related to a joint, to a spine, to a back, to a shoulder, and we kind of make it together. That's why I say tying it together is one of the most important things we can do as a practicing physicians out here in El Paso. Now, we have a lot of great chiropractors, a lot of good ones, and over the years, the technologies and the techniques that each one of these chiropractors are very, very proprietary. They're very singular. A chiropractor that you see today in Egypt is different than a chiropractor in El Paso. But they may be practicing the same way, but the hand and the touch of someone that knows what they're doing is priceless. So what we do is we try to educate the public as to how to find a doctor that correlates the extremes and can actually discuss the issues that are pertaining to them. Because sometimes it doesn't make sense. We can look at an autoimmune disorder and ask, what does that have to do with motion? Well, it has a lot to do with it, because if you have an autoimmune disorder such as a rheumatoid issue or an inflammatory disorder, we can relate that it is going to affect the joints. A good clinician will be able to assess what type of doctor, which is the best provider, and what type of treatments are the best appropriate for the patient, referring appropriately and determining what's the best mode of action. Now, the tools that we use subjective, objective assessment, neurological assessments. Without getting too complex, we use a lot of methods in order to assess and tie in what is wrong with the patient. We can relate to intestinal dysbiosis and actually like SIBO, small intestinal bacterial overgrowth. Those issues have a direct effect on inflammation, which have a direct effect on the entire body's immune system. A person who has an intestinal dysbiosis will most likely have some sort of inflammatory disorder in their body and ultimately have issues with their joints. That is our goal, to be able to assess the joint issues, the spine issues, the back problems, and determine exactly what is going on with the patient.